Hi everybody, County Executive Ryan McMahon here. Today I am joined by our Mayor Bud Walsh of the City of Syracuse, Emergency Management Commissioner Dan Weirs, and Dr. Gupta. We want to thank you all for tuning in today. We're utilizing this briefing to really update you on certainly any new information that we have available. And as this process continues to evolve, there is new information, and there's new information on a daily basis, and different best practices and policies are changing as more information is brought to us. So first off, just to give a generic update, the 21 individuals are still in quarantine organized through the health department. That does not mean that there are not people who are self-quarantining at this point. The people do that on their own, and that is fine. There are no cases of COVID-19 at this point, which is still the position that we've had. Certainly over the last few days, we've seen different decisions being made by leaders regarding social distancing. And I know the mayor is going to talk a little bit more about that from some specific questions he's been getting. But we have a graph actually right here. And really what the crux is if we can really work on social distancing, and by 25%, we cut that number down by 25%, whether that's activities of people going out to events or thinning out crowds, you can see the bar graph and how it goes with potential infected cases. When you do it by 50%, the graph obviously more, and then obviously 75%, the graph stays very flat. That's really important, and I think when you see what the federal government is doing, when you see what many organizations are doing with canceling different types of events, the governor's executive order, this is why they're doing that right now. And there's certainly pain, and there's economic pain. And that's why we need to continue to support our local economy each way we have. And I got an email that I specifically want to address. They said, County Executive, you're contradicting yourself when you say we can't have a parade, but then you say go out and support your local economy. When you have thousands of people together, that's a mass gathering. That's a tremendous opportunity for any virus to be spread. But when you're going to a restaurant where you're sitting at a booth with 25 other people in a building, that is what we're talking about with social distancing. Or if you're taking takeout at your favorite restaurant. So there's a difference between these mass gatherings and then still supporting local businesses in a way. So also, why are we doing what we're doing and giving the advice we're giving related to working with your primary care physician? This graph here is that reason alone. We need to make sure that our medical infrastructure holds up. We have a robust infrastructure, but to do that, we need you to call your primary care provider if you have symptoms. Organize a plan if they feel you need to get tested for the COVID-19. We can't have everybody inundating the ER for testing, inundating urgent care for testing. We need to have some sort of structure and order related to that so that our medical infrastructure holds up and can continue to perform very well. In regard to testing, there's been a lot of questions and a lot of things about testing. So we want to spend a little bit of time talking about the specifics of this, what this means. First off, you should only be getting a test if you're sick. Right now, we can't have 470,000 tests in Onondaga County when most of these people are not sick and we already know don't have COVID-19. By having all that kind of tests, regardless, it would backdate and it would crush this curve because the labs would get backed up. Your doctor's offices would get backed up, and people who are sick with other reasons that need emergency care outside of what the COVID-19 situation presents us won't be able to get that care. So testing is for people that are sick that your primary care provider will let you know if they believe you should get a test. Secondly, there's a lot of different reports going on nationally, but we can talk about what's going on here locally. All of our guidance on testing comes from the New York State Department of Health to all physicians. There is specific guidance that needs to be lived up to test for COVID-19. That's what we just talked about. All tests are authorized by primary care physicians or emergency rooms at this point. The state has removed barriers that at one time required our health department to authorize testing. We talked about the evolving rules. At one time, to get a test for COVID-19, Dr. Gupta and her team needed to authorize that. That is not the case anymore. So there are many, many questions about how many tests have been done in Onondaga County. That is a moving number, and it's very hard for us to track, but we eventually get data in. So what we can tell you is that there has been 7 tests that were authorized by our health department locally, and all of those 7 tests were negative. In addition to that, how is a test administered? A test is administered simply by either an oral swab or a nasal swab. That's something that is done. That swab is then sent right now currently to the Wadsworth lab in Albany, or the private sector companies have now been granted the ability to test as well. So if your primary care provider has a contract with a primary care testing company and they now offer the COVID-19 test, that primary care provider can send that test out to the private company, and then those results then come back in. Certainly, from the community's responsibility, we have a responsibility to help make these graphs go in the right direction. We need you to contact your primary care provider if you're sick. If you are sick, we don't want you going to work. Please stay home. If your child's sick, have them stay home from school. In addition to that, we need to continue to have good habits related to cleaning, washing your hands, disinfecting your property. If you have you at your desk, at your home office, if you're on computers, laptops, disinfect them with wipes. These are all things that we can do that will help us get through this process right now and this really COVID-19 threat. Again, for more information, continue to look at our Facebook Live briefings that we'll have. Our health department website continues to update information from the Center for Disease Control, frequently asked questions. You can also call 211 with questions. So there's an abundance of information, and we'll continue to get information out so that you get your questions answered. At this time, I wanted to turn the microphone over to Mayor Bud Walsh so he can address many of the questions and concerns that he's receiving.
Thank you, County Executive. Thank you all for joining us today. Just wanted to add a little bit more guidance to what the County Executive talked about. He, I think, made a very compelling case for why we're putting these measures into place, particularly as it relates to minimizing mass gatherings. So the governor put out an order yesterday. We've been receiving a lot of questions on it, especially as we're heading into what is considered by many people a holiday weekend with the parade, which, as we know, has been postponed. Just to reiterate those guidelines, any mass gatherings, 500 people or over, are not allowed at this time. For less than 500, the governor has stated that you have to cut your capacity in half. So if there's a maximum occupancy in a business, you want to cut that number in half, and that's what's required. Again, for very good reasons, backed by science. We understand it is difficult on a lot of our local businesses, but it's temporary in nature. And if we do it right, that will ensure that we will sooner be able to get back to normal. But in the meantime, there are some exceptions, which I want to make sure everyone's clear on to those rules. And largely those exceptions are based on the fact that individuals are not making sustained close contact. So whereas at a parade you might be standing next to the same person for an extended period of time, these exceptions are places where you may be with a lot of people, but you're moving around and keeping safe distances more often than not. Those exceptions are schools, hospitals, public buildings, mass transit, grocery stores, and retail stores. So if you fall into those categories, there is an exception, although again, where you can take proactive steps to increase distancing and decrease mass gatherings, those are welcome. Those rules go into effect today at 5:00 p.m. So going forward, we will be looking for everyone to follow those guidelines related to mass gatherings. If you have questions, you're welcome to reach out to our office or the county. But again, I want to stress these are temporary measures. They're important to slow the progression of cases. and the goal is to minimize the spread and to return back to normal as quickly as possible. I can't state that more emphatically. The sooner we all follow these guidelines, the sooner we get through this, the sooner we can get back to business as usual. We understand in the meantime it's going to be painful, but if we do it right and we lead by example, we will get through this. So thank you to the County Executive, Dr. Gupta, Commissioner Wares. We continue to have a great team here across governments. I'm really proud of what we're doing on the local level, in the city, in the county, and New York State. I think everyone here in our community should feel confident in your local and state leaders that we're doing everything we can. I know also just before this, Congressman Katko reached out to the both of us, making sure he's doing everything he can. Governor Cuomo's been very reactive and proactive in many cases and helpful. So again, everyone can feel good that we're all working. We're all in uncharted waters, but we're doing everything we can to keep everybody safe.
Thank you. Dr. Gupta, do you have anything to add?
Yeah, I just want to make sure that there is a significant anxiety in the community, because what they see in the TV, what they hear when they talk to each other, we got a lot of calls, and what we want to reassure people that we will have more capacity to do the testing. We are working with the health system very, very in a very close manner, very closely, and there will be much more opportunity for testing. However, it's very important to think about that testing should be prioritized based on the guidance which is provided, which is science-based. Can they change? Yes, they can change, but that's something we continue to update. At this point, I actually just send a provider alert, which as a commissioner I do send it to. Periodically, I inform them. Anything comes out from the state, I just reminded them they really need to follow the guidelines and get engaged with their patients. So when the patients are calling them, they really can go through the history, ask them, and what we call phone triage, and provide them right recommendation. Their patient needs help, and we are asking them to help their patients, and we are asking also the patient to call their doctors, because there is already trust built between them. So what your doctors will advise will really go further. And the only thing which I want to add in this is, as a local health department, we are there to help and support our medical community. There are criteria. Out of those 5 criteria, the 4 are very clear, and the 5th one is more that if the physician wants to do that, but that doesn't fit into those and feel strongly, that's how they pick up the phone, talk to us, and then we work with them. And there are few instances, but that's what we are there for. In addition to that, so let's work together to make sure we are supporting our medical community and our patients at the same time, or not patients, I should say, community members who would like actually the testing on a right time and a priority basis, because we want to focus on those 20% of patients who really may require hospitalization and then need a true diagnosis.
Commissioner Weirs.
One thing that we understand, our message from the beginning has been to call your local provider to get some direction of how to handle this. And part of that has been to limit the impact to our local health system into the hospitals. We also recognize that not everybody has a primary care physician. So one thing that we've done in coordination with Upstate Hospital is we're working to establish a community line phone bank that people will be able to call in and get some direction as to what are the appropriate steps for them to take based on that on their current situation. So hopefully in the near future we'll be able to announce a phone number and get that out to everybody, so if you don't have a primary care physician or if you have other questions, that's another source available to you to ask questions about how you can respond to this and what you can do to help yourself through this.
Thank you. So that's today's briefing. Again, as we get more information or there's any material changes, we will certainly alert the public and the media to that. But I think it's important overall that for us to get ahead of the curve. Right now we have no cases. That's why these policies and measures are coming in, and by implementing them, the amount of pain we'll suffer as a community to our healthcare system, to our economy, will be controllable. And right now we're all going through pain. And so where we can help each other, let's help each other. Let's be smart. We need your help to take care of yourself, take care of your families, and to be smart with exposing yourself to potential risk. We also need your help to support our local economy where you feel comfortable. But we can get through this. We'll be stronger at the end of this because we're working together in ways we never have before. And at the end of this, we will be much, much stronger as a community. So thank you, and stay tuned for our next update.